Welcome back to the channel. Today we are diving into Chapter 3, Understanding Public Nutrition and Health, for Class 12, Home Science. Complete with a chapter summary, MCQs and important questions. If you're new here, don't forget to subscribe and hit the bell icon so you never miss our videos. Public health is about collective efforts by society to protect and improve the health of entire populations. Within this, public health nutrition focuses specifically on preventing both undernutrition and overnutrition, aiming for a balanced and healthy nutritional status in communities. It is a multidisciplinary field that brings together science, education, and policy. Through large-scale programs and government action, public nutrition helps prevent nutrition-related diseases and promotes healthier lifestyles for all. Public nutrition is critical to national health and development. In India, malnutrition contributes to around half of all deaths in children under 5. Low birth weight affects nearly 1 in 5 infants, increasing their risk of poor health and early death. Undernutrition is widespread, nearly half of preschoolers suffer from growth retardation. Micronutrient deficiencies, also known as hidden hunger, are extremely common. Lack of nutrients like iron, vitamin A, and iodine harms brain development and reduces productivity, affecting individuals and the economy. India now faces a double burden of malnutrition, undernutrition in some groups, and overnutrition in others. Overnutrition, caused by sedentary lifestyles and poor diets, leads to obesity and diseases like diabetes and heart problems. Lastly, poorly nourished individuals, whether underweight or obese, are more vulnerable to infections and severe illness. This makes public nutrition a national priority. India faces several serious nutritional challenges. One major issue is protein-energy malnutrition or PEM, especially in children. This results from not getting enough calories and protein. It shows up as underweight, stunting, wasting, or more severe conditions like marasmus and kwashiorkor. Another critical problem is iron deficiency anemia, the most widespread nutritional disorder. It affects women, adolescents, pregnant women, and children, causing low energy, reduced concentration, and developmental delays. Vitamin A deficiency can lead to night blindness, even total blindness, along with increased risk of infection and poor growth. Finally, iodine deficiency is common in areas with iodine-poor soil. It causes goiter in adults and, if exposure happens before birth, can result in cretinism, permanent physical and mental impairment in children. Addressing these issues is essential for India's health and future productivity. The Indian government plays a vital role in improving public nutrition through a variety of programs. Under Poshan Adhyayan, multiple schemes are coordinated to improve outcomes for women and children. Direct interventions include the ICDS scheme, fortified foods like iodine salt, and vitamin and mineral supplementation for vulnerable groups. There are also indirect policies, like employment schemes, the public distribution system, and women's welfare programs, designed to address long-term nutritional security. To tackle nutritional problems, two key strategies are used. The first is the food-based approach, which is long-term, natural, and safe. It includes promoting a diverse diet, growing food at home, and educating people about nutrition. The second is the nutrient-based or medicinal approach, which provides specific vitamin or mineral supplements to those at risk, such as pregnant women or children. Although effective in the short term, supplements can be expensive and harder to distribute widely. The ultimate goal is to transition to sustainable food-based methods for lasting impact. Public nutritionists play a vital role in promoting health and preventing disease at the population level. They are trained in areas like nutritional science, dietary needs across life stages, clinical assessment, food science, education methods, and managing nutrition programs. Their work isn't limited to clinics, they operate in hospitals, manage government schemes like ICDS, and even work with NGOs and international bodies such as UNICEF. Public nutritionists also contribute as consultants, educators, researchers, and even entrepreneurs, making a real difference across sectors and society. Now, let's test your knowledge. What does public nutrition mainly focus on? A. Cooking food at home. B. Nutrition for individuals only. C. Health and nutrition of the whole community. D. Making junk food tasty. Which group is most affected by malnutrition in India? A. Rich people. B. Tourists. C. Children and women. D. Working men. What is the meaning of undernutrition? A. Eating too much. B. Not eating enough healthy food. C. Drinking lots of water. D. Only eating sweets. Which government program provides free lunch to school children? A. ICDS. B. Mid-day meal scheme. C. PDS. D. Ayushman Bharat. What does ICDS stand for? A. Indian Child Development Scheme. B. Integrated Child Development Services. C. Internal Care for Developing Students. D. International Community Development Scheme. What is the aim of the Public Distribution System, PDS? A. Sell snacks. B. Distribute free clothes. C. Provide food grains at low prices. D. Offer free medical checkups. Which of the following is a micronutrient deficiency common in India? A. Protein. B. Vitamin A. C. Carbohydrate. D. Fat. Who plays a major role in spreading nutrition awareness? A. Only doctors. B. Only farmers. C. Health workers, teachers, and the community. D. Actors and singers. Which problem is caused by eating too much junk food? A. Undernutrition. B. Obesity and lifestyle diseases. C. Weak bones. D. Vitamin D deficiency only. Why is nutrition education important? A. To teach cooking recipes. B. To open restaurants. C. To teach people about healthy eating and disease prevention. D. To make food spicier. Let us now take a look at some important questions. Very short answer questions, 2 marks. What is public nutrition? Public nutrition means caring for the food and health needs of all people, especially the poor, children, and mothers, to help them stay healthy. Why is public nutrition important in India? Many people in India don't get enough healthy food. Public nutrition helps reduce diseases and improve growth and development in the country. What is malnutrition? Malnutrition happens when a person doesn't get the right kind of food, either too little or too much, leading to health problems. What are micronutrients? Micronutrients are vitamins and minerals, like iron and vitamin A, that our body needs in small amounts to stay strong and healthy. What is undernutrition? Undernutrition means not getting enough food, which can make people weak, sick, or unable to grow properly. Name 2 government schemes that fight malnutrition. The Midday Meal Scheme and ICDS, Anganwadi Services, help provide food and care to children and mothers. What is the Public Distribution System, PDS? PDS is a government program that gives food grains like rice and wheat at low prices to poor families. Who are the key people in public nutrition work? Health workers, nutritionists, teachers, and volunteers help teach people about healthy eating and run food programs. What is overnutrition? Overnutrition means eating too much, especially junk food, which can cause obesity and other health problems like diabetes. Why is nutrition education needed? Nutrition education teaches people what to eat, how to stay healthy, and how to avoid food-related diseases. Short answer questions, 3 marks. What are the common nutritional problems facing India? India faces several nutritional problems, especially among children, women, and poor families. These include undernutrition, not getting enough food or energy for proper growth and development. Micronutrient deficiencies, lack of vitamins and minerals like iron, vitamin A, and iodine. Overnutrition, eating too much unhealthy food, leading to obesity and diseases like diabetes. Protein energy malnutrition, PEM, seen in children, causing weakness, stunted growth, and diseases like kwashiorkor and marasmus. Anemia, mostly in women and children due to a lack of iron in the diet. Discuss the various strategies that can be adopted to combat public nutrition problems. Strategies to combat public nutrition problems, nutrition education, teach people about healthy eating. Government schemes, midday meal, ICDS, and PDS. Food fortification, add nutrients to common foods. health checkups, regular checkups and supplements. Community support, local help in spreading awareness. How does the midday meal scheme help children? This scheme gives free lunch to children in government schools. It helps fight hunger, keeps children healthy, and encourages them to attend school regularly. How does ICDS support mothers and children? ICDS runs Anganwadi centers that give food, health checkups, and early education. It focuses on children under 6 years and pregnant or nursing mothers. What are the causes of malnutrition in India? Poor food, lack of education, poverty, and limited healthcare are big causes. Many people don't know what to eat or cannot afford healthy food. Long answer questions, 5 marks. What are the consequences of IDA and IDD? IDA or iron deficiency anemia makes you feel very tired and weak because your body doesn't get enough oxygen. It can cause pale skin, headaches, and poor memory. IDD or iodine deficiency disorders can cause goiter, that is, a big swelling in the neck. It affects the brain, causing mental problems in babies. In children, both can lead to slow growth, poor learning, and low energy in daily life. Pregnant women with these issues can have weak babies or problems during delivery. What is the scope of public health nutrition? List some of the career choices in this area. Public health nutrition focuses on improving the health and nutrition of the whole population. It works on preventing malnutrition, lifestyle diseases like diabetes, obesity, and spreading awareness about healthy eating habits. It also includes creating nutrition policies and managing nutrition programs at the community, school, or national levels. Career choices in public health nutrition include a clinical dietitian, nutrition program coordinator, public health educator, food safety officer, researcher in nutrition, NGO worker in health projects, community nutritionist, policy advisor, health or nutrition. Thank you for watching. If you found this helpful, please like, share, and subscribe to Adhyayan Academy. And don't forget to press the bell icon for more educational videos. See you in the next lesson.